The pandemic took so much away from us in terms of personal connection. What a lot of the staff were saying is, I feel invisible, right? Like all of this stuff is happening. I'm exhausted. I'm working short-staffed. I'm working multiple shifts. I can't take a break. My patients are so sick. I'm trying to do the best they can. So the CARES cart idea was a way that people could come together, connect, to get a little bit of a break, some food, some recognition, someone to understand that they're really, really valuable, and then also for them to know that there's a range of other resources and supports that are available if they need.
We wanted to make sure that the program was going to support not just clinical-facing roles, but people who had non-clinical roles. Doing that meant trying to be creative about how we understand the kinds of problems that different people had and the best ways to address those.
So we did interviews and focus groups with individuals in administration in the front lines to get a sense of what are their staff struggling with. We met with staff members, and we also looked at some of the issues that were being raised by staff in UHN Open Forum.
Different kinds of digital images that healthcare providers were making or talking about, particularly in relation to burnout and the emotions that were brought up through the pandemic. So what you see here is a figure standing in a darkened area. There are red shoots of flame coming from their shoe all the way up through their body. And then there's stethoscope wrapped around their wrists, almost binding their wrists behind their back. The meaning that's embedded in the image is very different than the kind of message that you get about burnout from the conventional research. Some of the things that were key parts of our success were how easy it was for healthcare providers to be connected with individuals. We had shorter wait times than you might ever imagine for mental health support. And we had a very responsive way to manage any kind of crisis issue that was coming up.
We got feedback that this program is really a microcosm of what mental health care and psychiatric care should always be. It should be proactive. We should be doing outreach. It should be low barrier when people are in high distress. We should be able to provide rapid access and appointments on short order so that people get the care that they need.